And back to our top story today, a cloud of doubt hovering over what may be the world's first vaccine for COVID-19. Russian President Vladimir Putin himself announced that his country has developed the vaccine called Sputnik V. But critics were quick to raise concerns about its safety and effectiveness. How soon can Filipinos access this vaccine? We now talk to Food and Drug Administration Director General Eric Domingo. Good morning, sir. What's your take on the supposed COVID-19 vaccine developed by Russia?
Yeah, hi, good morning, Ria. Well, we really would like to get more information on the vaccine and what the approval process was, because usually we approve vaccines after they complete a third phase of the clinical trials. And as far as we know, this vaccine is in the second phase of the clinical trial. So we really want to know how accelerated the approval was and what the basis was for that.
All right, so if indeed this Russian vaccine reaches local shores, will we, the Philippines, conduct separate testing of the vaccine?
Well, no, not as a country. Usually it's the developer who does the clinical trials, unless the clinical trial is sponsored, for example, by the Department of Health. That can also be done. No? But in our setting, we do approve vaccines after the completion of a large number of patients being vaccinated and the safety and efficacy is assured. That means after a phase 3 clinical trial, where about maybe 1,000 up to 20,000 patients have been inoculated.
All right, so you were saying we're not yet at stage 3, we're at stage 2, as far as you know, is that right?
Yes, as far as we know, the Russian vaccine is at stage 2, and there are, I think it was calendared to start the phase 3 clinical trials this month.
Okay, so after all of these tests, and assuming that it does get past stage 3, how long does it usually take before a vaccine becomes available to the public? Do you see this happening before Christmas, let's say?
Possible, not exactly maybe 100 billion doses. That depends also on first of all, you have to register it. That would take about a month, maybe 2 weeks to a month. Production line. It depends on the capacity of the company to produce the vaccines and how they distribute it. Then the first doses may happen, may be available before the end of the year, because there are quite a lot. There are about 6 or 7 vaccines that are now at the clinical trial phase 3 stage. So that would take about 2 to 3 months. And then registration, by the earliest vaccines would probably be available by end of the year to early next year.
So that is entirely possible. Sir, could you tell us about other vaccines that are being developed from different countries? Do you have any updates on those? And do you think we would prefer to take those vaccines from countries that are more traditionally known to produce this type of medicine?
It's really, whoever deliver and who first have a vaccine approved would probably get, some advantage. There are about 165 vaccines in development now. About 25 of them are in clinical trial stages, and 6 or 7 are in the phase 3. So there are about, I think there's 2 from the US, 3 from China, and of course this one from...
All right, I think we lost the line there, but that was Food and Drug Administration Director General Eric Domingo.